In this section, we will train you on the proper use of the HoverMatt air transfer system in the operating room. We'll explain how to prepare an operating table with the HoverMatt and show the correct technique for transferring onto and off of an operating table. Please review the HoverMatt training video for detailed instructions before using the HoverMatt air transfer system. If the patient can transfer independently onto the surgical table, then the HoverMatt should be preset on the table. If utilizing a gel pad for pressure relief during the procedure, place the pad on the OR table first. Then place a sheet between it and the HoverMatt. If desired, place linens and protective pads on the device to keep the surface clean. HoverTech offers 2 disposable sheet options that can be used to protect the HoverMatt. The Hover Cover is a highly absorbent disposable sheet that wicks away moisture and helps control the microclimate of the patient's skin. The logo side of the sheet is placed facing down, while the absorbent side is against the patient's skin. The disposable sheet provides another option, featuring an electronically weakened center line for easy removal post-surgery. The smooth, shiny side is placed facing down, while the textured absorbent side is against the patient's skin. To keep the patient's safety straps out of the way, connect them below the surgical table or tuck them underneath the table pad, along with the overhanging sides of the HoverMatt and sheets or pads to keep them out of the way of any equipment that may be connected to the side rails of the OR table. Patients who cannot help themselves onto the OR table can be placed on the HoverMatt in holding or pre-op using the log roll technique. The HoverMatt can then be used to laterally transfer the patient onto the surgical table. For demonstration purposes only, there will be no linens on top of the HoverMatt in this segment. It is recommended that a sheet be placed between the patient's body and the HoverMatt. With the stretcher wheels locked and rails down, insert the air supply hose into the HoverMatt. One caregiver should assume the position of safety, advise the patient of the move, and instruct the other caregiver to turn on the air supply using the appropriate button for the HoverMatt width. Once the HoverMatt is fully inflated, the caregiver next to the patient pushes the HoverMatt at an angle towards the receiving caregiver. Because the HoverMatt is wider than the OR table, it is especially important that the receiving caregiver's body is positioned against the table to ensure the stay close approach. Once the caregiver has received the HoverMatt and patient, the other caregiver will move to the foot end of the OR table to verify that the patient's body is centered on the surgical table. This step is very important to ensure the patient's safety prior to HoverMatt deflation. Once both caregivers have assessed the patient's positioning, one caregiver should assume the position of safety and inform the patient that the HoverMatt will deflate. The caregiver at the foot end will then press the standby button to deflate the HoverMatt. The safety straps can be removed and tucked under the OR table mattress pad along with the HoverMatt or connected under the table. The patient will remain on the deflated HoverMatt during the surgical procedure. After the procedure, untuck the HoverMatt and connect the safety straps. With the stretcher locked in position next to the surgical table, transfer onto the stretcher using the same safe patient handling techniques. In PACU, the patient can remain on the deflated HoverMatt for future transfers, positioning, to ease the insertion of a portable cassette if an X-ray is needed, or to offload for circulatory benefits and patient comfort. Please refer to the HoverMatt user manual for more information.